Hello, everyone. My name's Andy Biggs. I'm the Congressman from Arizona's 5th Congressional District. And this is another one of our video streams that give you information on what's happening in Washington, D.C. and other information. And we have a special, I have a special guest with me today. Mr. Phil Kerpen is a leading free market policy analyst and advocate in Washington. He leads American Commitment. He previously worked for Americans for Prosperity and Club for Growth. You can follow his excellent work, his really excellent work on Twitter at Kerpen, K-E-R-P-E-N. Phil has done some fantastic research and analysis into nursing home data from this coronavirus outbreak. And you can find an updated Google spreadsheet with this data on his Twitter account. And I'm excited to talk to Phil because I have actually taken a good look at that spreadsheet that you have, and we're going to get to that in just a minute. But I want to talk to you, Phil. Thanks for joining me, by the way.
My pleasure.
How much really of COVID is really a nursing home problem or an assisted living facility problem vis-a-vis a problem in the general community?
Well, it varies a little bit by state, but I think that nationally it's pretty clear now that more than half the deaths are in nursing homes or other long-term care facilities. And I use the word nursing home just to refer to all of them. I know technically a lot of them are other things, but that's the most common term that most people use. So that's the term that I use. And in some states, it's really staggering, the numbers that we're seeing. For instance, up in Minnesota, they've got about 100 total deaths outside of nursing homes, and they've got about 500 in the nursing homes. They're talking 80%. There basically is no COVID outside the nursing homes in that state, and yet their governor, Democrat Tim Walz, has them on lockdown. That's really crazy to me. You look at the hard-hit states in the Northeast, the ones that really, really got hammered at very high death numbers, and their nursing home totals are staggering. In Pennsylvania, over 2,500 nursing home residents have died. It's more than 2/3 of their total COVID deaths, and they had some major policy missteps that resulted in that. There was one nursing home medical caretaker who wrote a really heartbreaking post that I read about how he started getting these positives in his nursing home, and he was calling the Philadelphia hospitals, which were all empty at the time. They'd emptied out because they thought a big wave of patients was going to come like New York, and they wouldn't take his patients. They said, no, you got to keep them at the nursing home. We can't have them here in the hospital because we need to preserve our capacity and all this kind of stuff. Well, the wave of non-nursing home patients never came in Pennsylvania, but they have these sky-high death numbers at the nursing homes because of those bad policy decisions they made. And then it came out yesterday that the director of the Department of Health in the state of Pennsylvania took her own mother out of a nursing home the same time that these deaths were racking up, which is really a horrible, horrible look. New York is only reporting, they're only claiming to have about 5,500 nursing home deaths, which is about 1/4 of their total death toll, but they're not reporting it the same way any of the other states are. Every other state is giving us the number of nursing home residents who died, no matter where they died. New York is only giving us the number of nursing home residents who died in the nursing home. So they put a footnote on that said, if they die outside of the facility, they're not included in the statistics. And obviously, they probably had thousands of nursing home residents who were hospitalized and died at the hospital. They won't give us that number. So I assume it's more like 10,000 nursing home residents that died in New York than the 5,000 they're admitting to. And you look at sort of all these other states in the Northeast, it's a very similar story ever. It's over 60% in Massachusetts. It's about 65% in Connecticut. All of these states with very high death tolls are very lopsided in terms of the deaths taking place in the nursing homes. And even the not as hard hit states, we're seeing sort of the same pattern. So your own state, Arizona, is actually one of the 10 or 12 that doesn't have statewide nursing home death reporting, which is unfortunate. But we do have Maricopa County, where about 65% the last time I checked were in nursing homes. But it's a small number. I mean, I think the total deaths are around 200, so the nursing home deaths are around 120, 130, something like that. So we're not talking about the thousands and thousands of deaths we're seeing in some of these other states, but to the extent you have any kind of an issue there in Arizona, it's really predominantly in the nursing homes. And one of the other non-reporting states, unfortunately, is Michigan, which means we don't really have a clear national picture because that's another one of the very hard-hit states, and we just don't have information there about how much of it's in the nursing home. The good news is we are going to get national data on this pretty soon. CMS did an interim final rule last week requiring every long-term care facility in the country to report the number of infected patients they have and the number of deaths they've had of residents in that facility. And that data is going to be made public by CMS. They say they're going to do it weekly. So we don't have the first report yet, but I'm hoping we'll get that soon. It'll probably be not as timely as some of the state data we're seeing, but it'll give us a look at least at the states that are not reporting, and it'll give us sort of a uniform national set of data on this. But to answer your question, this is mostly a nursing home problem, more so than it is a disease in the general population.
So you've talked about policy missteps. And so when we start talking about policy, and I know New York had one of their policy steps was basically to put people into these nursing home facilities and not let them really be coming out too much. So why was it, what were these policies and why was it so much worse in New York, New Jersey, Pennsylvania, and maybe some of those others in the Northeast?
Well, I think the biggest mistake they made was this policy that required all nursing homes to accept infected and infectious patients, whether they were prepared to isolate them properly or not. And this was done in all of these states. These orders came down from departments of health or from the governors directly that basically said, you cannot refuse a readmission. If somebody gets sick, they go to the hospital, they're still infectious, but they're not in critical and the hospital wants to discharge them, you have to take them back. And that created a really big problem because a lot of these facilities weren't equipped to do that. I also think that the lockdowns, perversely, may have had a negative impact on our ability to deal with this problem in the nursing homes, because if you look in the April jobs data, the number of employees in nursing homes in this country went down by 113,000, which is a very large employment drop. And we're going to have to do some more research to find out if that was people quitting because they were scared that they would get the virus there, or if that were layoffs for economic reasons or what have you. But I think that they were overburdened and they were losing staff, either because of economic reasons or because people were quitting. And there was this huge push, I think, to build up hospital capacity and hospital resources. And it just ignored what should have been the central lesson from all the other countries that had this, which is this hits hardest in long-term care homes. Half the deaths in Europe are in long-term care homes. We knew the age stratification was older and sicker people, so we really should have been prepared for this, but instead we were building field hospitals that basically didn't get used and not moving nursing home patients who were infectious out of facilities where they really couldn't be properly cared for and then the rest of the population protected when we could have been using those resources much more effectively. And those were all policy decisions, I think, by those states. And, the Trump administration, to their credit, very early on, gave a lot of regulatory flexibility on nursing homes. They basically told states, look, if you want to move people between facilities, you can do that. If you want to designate facilities COVID only or no COVID, you can do that. And so the normal obstacles to the types of responses we might have preferred to see were largely waived. There really weren't federal regulatory reasons they couldn't have done these things more effectively. They just they made a decision, I guess it's easy to question it in retrospect, but they made a decision basically that they wanted to preserve their hospitals and their hospital capacity for people from the general population and keep nursing home patients where they were to the greatest extent possible. And it now looks like that was a catastrophic miscalculation.
Well, when you talk about nationwide people leaving that field of work, working in the nursing homes, care workers, I know this may seem anecdotal, but when I've talked to the assisted care living folks in Arizona, what they've told me is they had a lot of people who basically were not trained, didn't feel they were trained, also didn't have all the PPE that they necessarily would have liked to have. And, they're traditionally $12, $14 an hour workers, right? And so they look at it and say they felt that there was risk. So there was some fear there as well. So, I mean, you have so at the same time you have the folks fleeing, you actually, the employees fleeing, you also have the things I think you pointed out, which are really critical to really get wrapped around, is these folks hadn't been trained to deal with this type of peculiar virus. They didn't have the equipment. Ventilators were at the hospitals. They weren't in the nursing homes necessarily.
Yeah, I mean, look, there were a lot of factors, I think, and everything you just said is true. The staff in these facilities make much, much less than the nursing staff in hospitals, even when they are comparably trained. And of course, you've got a lot of people who are much less skilled, sort of unskilled, just non-nursing care positions as well. And you had a bunch of other things going on at the same time. Remember, all the schools were closing. A lot of these people have kids, and so if you're making a relatively low wage at a job and you need someone to watch your kids anyway now because the school is closed, a lot of people might make the decision to stay at home instead and watch those kids. That might have been one of the factors. You've got the 600 a week plus up in federal unemployment. If you can make more, if if you're working for $12 an hour, 40 hours a week, you're making $480. You can go on unemployment and make $600 or $700, depending on what state you're in and the state benefit. That's a big raise if you can qualify for unemployment. And so, if these places were under pressure, you don't want to quit if you were trying to get unemployment. But if these places were already under economic pressure because the whole economy was going down and they're asking, would anyone mind being laid off? I think a lot of people in those circumstances would say, no, because I got to watch my kid and I'm going to make more laid off anyway. And so that might be part of it too. And I also think that Congress really didn't understand this issue either, because, you guys have spent $2.5 trillion now on these various bills. And as far as I know, very little, if any of that, went to beefing up nursing home capacity.
Right. They needed to get, so they've ostensibly, they've allocated some maybe of that last bill, second to the last bill. But the reality is it's been slow going, getting the money out anyway. I mean, whether it's to rural hospitals, which are going under because you said, okay, you can't do elective surgery, so they're under.
And by the way, that we have to blame the Trump administration for that, because that was a memo that went out from CMS that said everyone should stop, everyone should postpone basically everything except COVID care. And, a lot of states adopted it as policy, but even states that didn't, everyone complied with it when the memo came out from CMS, and it took them a month to modify that memo. So I think that was a massive miscalculation. And by the way, when liberals tell me that somehow this disaster is a reason we should have Medicare for all, my number one response is, the biggest policy error that we had probably was the one that came from Medicare, that shut down our whole health system for everything other than COVID care. The idea that Medicare should be entrusted with more power over more people is the exact opposite lesson we ought to learn from that, in my judgment.
Yeah, so that's been rough. I mean, the one thing, you're right, I don't think, because I checked the Arizona data on a daily basis. I mean, it's out there to look at. They have a really nice dashboard. Anybody can look at it. They don't have that segregated for nursing homes, et cetera. But the one thing that they do is they keep track of the ventilators, the ICU beds available, and the general beds available. And Arizona's had probably 28% of the ventilators in use has been the tops I've seen. ICU, maybe 68% has been pretty close to the top I've seen. So you have 30% vacancy, and then your general beds, some wide open spaces there. So
I think you guys should be 100% open. You should be business as usual, in my judgment. There's just very little disease there. And, to your governor's credit, he is opening things faster than a lot of other states, and faster than he had previously announced, which is a nice improvement. Yeah. Another thing about ventilators that I think is really important, because we kept being told we're going to need, Cuomo said we need 30,000 ventilators or all these people are going to die that otherwise would be preventable, all this kind of thing. And we did Defense Production Act and the government stepped in, all this stuff. And it turns out that we needed a tiny fraction of the ventilators that we thought, for two reasons. One is that the patients didn't materialize in the same numbers that the models and projections said they would. But two is that the ventilators, it turns out, are not nearly as helpful for as many patients as we thought they were. It's an interesting phenomenon because, we originally, the doctors thought, let's treat this just like we would treat any acute respiratory distress syndrome. We see oxygen saturation dropping down under 90, let's intubate. And we've since learned that you get much better outcomes if you don't. If instead you say, even though your blood oxygen is reading low, we're going to keep you, we're not going to sedate you, we're not going to intubate you, we might turn you on your stomach, put you in a prone position, or we might put a high flow nasal cannula in, or other types of oxygen support. But the paradigm of treatment changed from early in New York, where they were saying, let's get everyone on ventilators as early as we can. They're getting actually now much better outcomes not doing that. And so we've learned a lot medically that I think is going to reduce the death rate going forward if there are places that continue to be hard hit. But one of the interesting lessons is what we were all told was this huge imperative that we had to massively invest in and build out. Turns out not even to be the best tool in most of these cases for helping people.
Yeah, and before we leave New York, because I think it's interesting to see, Cuomo, I think, was surprised to learn that something like 66% of the spread was family related. The community spread was family, and that stands to reason because everybody's locked down. They're with these people. If anybody's got it, they're probably going to pass it on to those people.
Yeah, I thought that survey was really interesting because I think he did that survey. He did this survey of like a couple thousand hospitalized patients in the New York hospitals to try to figure out where they contracted the infection. And I think he did it because he was trying to answer criticisms from me and others that the subway was the main source of transmission in New York. And so he was trying to disprove that. And he thought, we're going to do this survey. We're going to show that people weren't on the subway. And the interesting thing is the results he published can be used to argue that it wasn't the subway, but they also sort of undermine the whole argument for the lockdown because, he found that 66% of the people, as you said, caught the infection while they were sheltering in place, while they were locked down at home. He said these were not essential workers. These were not people who were going out every day. These were people who were at home, who were listening to what I said, who were isolating themselves, and somehow they caught it anyway. Now, we don't know if it's from ventilation systems in their buildings or if it's from deliveries. I mean, people ask, how is that possible? I don't know how it's possible, but I just know the facts are what they are. That's his own survey. That's what it found. And you really have to question whether the lockdowns have any efficacy at all if people continue to be infected at that kind of rate while you're locked down. And, obviously we know that they have this enormous cost associated with them. And so I think it's I always thought it was a very poorly targeted response, but now I'm wondering if it might be almost completely ineffective, even at limiting the spread based on those New York results.
Yeah, I mean, there's one of the questions that comes to my mind immediately is how many of those folks were asymptomatic and didn't even know they were just taking it home. Because
you're surveying the hospitalized people. Yeah, I don't know. I mean, obviously they got it from somebody or something. I mean, it could. I would have liked to see housing type in that survey. They didn't include it. It would have been interesting to see if these were mostly apartment buildings or single family homes, because you could imagine, if it is something, we still don't know a lot about the transmission. If it is something that can go through a ventilation system, then obviously multifamily housing. Sheltering at home might have more problems. So there's a lot we don't know out of that survey, but the one thing it does seem to point pretty clearly to is that shelter at home was not limiting the spread in New York. And that's why even while they were locked down, you were able to see that huge increase and the terrible numbers they have there.
Yeah, so when we start looking at the lockdown, we've had a tremendous, that has had a tremendous deleterious effect on our economy. So how do you see how severe the lockdown, how severe is that lockdown's impact on our economy, in your opinion?
Well, Jay Powell said today that 40% of people making 40 grand or less lost their jobs. Now what commentary can I even offer on that? I mean, it speaks for itself. I mean, we've never seen anything like this. It's absolutely devastating economically. And, there's, I think, this very sort of naive view among way too many people in our media and political class that, well, you can just make up for it by pushing more money out the door, by having more government spending, more unemployment payments, more giveaways. And besides the fact that we need to figure out a way to pay for all of that, there's another sort of fundamental problem with that idea, which is you can't buy products and services that don't exist. If the economy's not producing, if we're not working, if we're not making things, if we're not building things, then no matter how much money people have in their hands, they're not going to be able to have a good quality of life, because they, if every barber in town is closed, it doesn't matter how much money you have to pay for a haircut, you're going to not have one. And of course, that's sort of a nuisance thing and an obvious example, but there's so many other products and services we rely on. At some point, you have a total breakdown of the society if people aren't able to work. And, the global impacts of these lockdowns are even worse. And that's what I find so remarkably short-sighted about these liberals. I mean, there was a study that was just published, I think in The Lancet, or one of the prestige medical journals anyway, that found that there could be up to 1.2 million children under the age of 5 who die worldwide as a consequence of the economic collapse. And, they try to say that's an indirect consequence of the virus. But to my mind, that's a consequence of the lockdowns, because the virus deaths could have been addressed and contained in a way that didn't crash the global economy. And, I think that the scope and scale of the deaths and the devastation and the economic losses associated with the lockdowns are just going to be massively, massively worse than the virus itself. And even worse, I'm not sure that we're actually doing much to limit the virus with the lockdowns, as we just said.
Yeah, no, and so Phil, when I look at this and I say, okay, we're talking about these other lives that will be lost simply because poverty does everything from gives you poor nutrition, which weakens your immune system. If you are able to work at all, you're going to be more public-facing type of employment. So you're going to be out there more in a more susceptible environment, or an environment more susceptible to passing and risk in that way. So we're not even just talking anymore about economics to economics, right? I mean, we begin talking about public health crisis to public health crisis to public health issue to something that was manageable in a certain way. Maybe you could have targeted where your response went. I mean, right, your hotspots were the assisted living nursing home facilities, wherever there's elderly, where there's comorbidities. But we didn't target that. What we did is we just took a meat cleaver to the whole economy. And when Powell said that today, you find yourself just kind of putting your hands to your head and say, how do you now rebuild that? Because when we start talking economics, Phil, I start thinking of certain capitalists or free marketeers will say demand creates consumption. And then others will argue consumption creates demand. Well, it doesn't really matter, because
if nobody's producing, nobody's going to be able to consume at some point.
Exactly. And so how do you pull the lever to start it up? I'm optimistic that we can get it going, but how do you get it going again?
Well, I think we've got two major problems right now that need to be addressed before the economy can really start moving again. The number one problem are the actual policy impediments, the bans, the lockdowns. If people are required to keep their doors closed, that business is not going to get off the ground. I mean, that sort of goes without speaking, goes without saying. But the second, which is kind of related to that, is we've got to calm the panic among the public. We've got to convince people that it's safe to go out, that it's not danger lurking behind every corner. And the media, I think, very irresponsibly has stoked panic rather than dispelling it. And unfortunately, most of our politicians have done the same. And, you see this sort of panic building, and most of it's irrational, because on an age stratified basis, this is, it's not dangerous. 174 children have died from the flu this year, this season, year to date. And I think 5 have died from COVID. So, for people to be scared of their kids going out or of going to school, it makes no sense. It's contrary to everything we know in all the data, but they'll find those 5 cases and they'll make it a headline, and then everyone will talk about it. And we've lost, I think, perspective of what the risk analysis is. I mean, you're more likely, for most people in most age brackets and health status, you're more likely to die commuting to work in your car than you are from this disease. And so life entails risk, and we need to put things in perspective and explain to people how we're dealing with the high risk situations. If we had a good plan for the people who are at risk in the nursing homes and other similar elderly and compromised, unhealthy individuals. And then we said, look, for everyone else, your risk is very, very small. You shouldn't fear. You should be able to get back. The irony of this whole wait for a vaccine kind of let's stay locked down for years if we have to thing is that for most of the population, the young and healthy population, the risk of this disease without a vaccine is comparable to the risk of other diseases with a vaccine. It's already extremely low risk for young, healthy people, and especially for children. We should be explaining that, making that case, calming people by using facts and science and data. And I've seen, I think, too little of that. But until we successfully do that, even when we open things up, the numbers are going to be pretty low. Of course, part of it will come with time, as we see Florida doing well, Georgia doing well, other places, Arizona opening up. if we see, and I think we all hope that we'll see this, that we don't see a big increase in cases, and maybe this thing will be sharply seasonal and it'll mostly end, then people's confidence will come back, and we'll see that gradually. It's just a matter of how long it'll take. But the one thing that I really worry about, and we mentioned this a little, is the $600 extra that Democrats insisted on, and for some reason the White House and the Senate agreed to. $600 a week that makes unemployment for about half the workers in America now. Unemployment pays more than work. So, if you lose your job, you go on unemployment, you're making more than you were making before when you were working. And I think this is already creating huge, huge problems, because what happens is business owners get the green light from their local or state government to reopen, and they call their employees and they say, we're opening on Monday, can you come back in? And the workers say, I was making $600 a week working for you. I'm making $900 or $1,000 now on unemployment. I really need the money because I've got a lot of things going on. Can you match what I'm getting on unemployment? Because otherwise, I really don't think I can do it. And think about the situation that puts employers in, because they're trying to get them off the mat. They've been shut down for months. They probably couldn't afford to pay that much in the first place. And now they've got to tell a worker, basically, they've got to either say, I understand, I'll try to find someone else, or they've got to somehow come up with money they don't have to get that worker to come back. Or their last option, which I think almost none of them will do, is they could actually call the unemployment office and say, I offered this person their job back and they didn't take it, cut off their benefits to try to force them to come back to work. But if you do that, what kind of an employee are you going to get? So yeah. I think it just puts people in a really, really tough situation. And that runs all the way through the end of July under current law, which means a lot of these places that are trying to open up, restaurants especially, I think they're going to find that it's very hard to get people to come back to work for that reason. And of course, the bill that Nancy Pelosi just introduced extends it another 6 months to the end of January. And I think Democrats want to permanently make it the case in this country that unemployment pays people more than working. And I just find that so bizarre and perverse. I'm amazed that they even try to defend it. I don't know if you recall this, but when the CARES Act was being done, they kept saying in their talking points up to 100% of what you made when you were working, up to 100%. And then the bill came out and there was no cap. It didn't say, it was up to 200%. I mean, there was no cap. And a bunch of senators thought it was a mistake, like this was written wrong, like you forgot to put the cap in. And, Lindsey Graham and Ben Sass and a couple others, they were saying, this is a drafting error, can you fix it? And Ron Wyden came out and he said, this is not a drafting error. We've wanted to do this for a long time. This is what we think the policy should be. And so we've now got a major political party in this country whose official position is not just in a crisis, but it seems all the time not working ought to pay more than working. And I don't know how you can have any kind of an economic recovery if that's the policy you have in place.
Well, and the other thing too, just to digress, you've pushed my button on, because this latest bill is really a grab bag of very leftist policies. They want to force extend the FMLA another 3 months as well. So if this were to pass, you take what you just described, where unemployment pays more for the next 8 months, and then you say, oh, and by the way, if you do get an employee back, they get an extra 3 months of family medical leave, right? I mean, you really actually the businesses are hosed is where it is. It makes it very difficult to open up. So that's it. So I wanted to get back to one question before we run out of time completely. But when we were talking about probably over half the fatalities with regard to COVID is taking place in nursing homes. Even with that, though, what can you tell us about the case fatality rate within nursing homes, or can you? Do we have enough data to really identify that?
I don't have the data broken out that way. We do have the age stratification, though, and I think you can assume that you could probably look at the over 75 or over 80 numbers and kind of use that as a proxy for the nursing home population. And so I think it's probably pretty high. It's probably up in the 10% range. This is a very nasty disease for the oldest and the frailest, and that's the population that it targets, and it can rip through with really devastating effect. Although we also should point out that we have a very bad definition right now from the CDC. They define a COVID death as any death with any cause of death in the presence of a positive test, a positive PCR test for the virus SARS-CoV-2. And so one of the things that I worry about is that while I think there are a lot of nursing home deaths that are being caused by this, sort of early in an epidemic, that kind of definition is fine while you're still dealing with a small number in a short period of time. I think as this goes on, you're going to have some facilities where every single person there is positive because they've all been exposed to it. And even if a lot of them are asymptomatic, they're going to die of something because the median stay in a nursing home before death is only about 5 or 6 months. And so when they die, if they're still testing positive, or even just based on the previous positive test that might be a couple of months old, I think they might get coded even though the actual virus had nothing to do with their cause of death. And I think that's something that Deborah Birx is very concerned about, is that this loose definition we have is leading to coding of deaths that really it didn't play a role in, and we're getting a higher number. And that's going to become more of a problem over time, just because more of the people who weren't hurt by it are going to eventually die for some other reason. And then if we don't fix our definition, we're not going to be able to distinguish those. And so it's a high number, but it's probably already starting to be overstated a little bit because of that definitional issue. And but the other side of the age stratification issue, which is equally important, I just saw a study that came out from France today, a peer-reviewed study from France, looked at the age distribution of all of their deaths in the country, and I think they had it about 10% for the highest age bracket of over 80, and for the youngest age bracket, they had 20 and under as the youngest age bracket, and they had the case fatality rate for the 20 and under at 0.001%. So if you're under 20 years old in the entire country of France and you got infected with this virus, you had a 1 in 100,000 chance of dying from it. And I think it's really important to keep that perspective in mind, especially there are only 3 states that have announced school reopenings: North Dakota, Idaho, and Montana. Everyone else has stayed closed through the end of the year. And so I think we need a better understanding of this before we start closing more schools into next year, really without justification.
Wow. Well, Phil, I want to thank you for the work that you're doing. You're doing great work, great data. I'd ask people to follow you. How do they follow you on Twitter?
It's just my last name, Kerpen, Kerpen, and my wife complains I'm on there like all the time, so I'm sort of an addict.
But there's a great spreadsheet available there. Give you all the comparisons, lots of data and information, and Phil's following the science and the data.
But tell your governor we want statewide numbers in Arizona.
I'll pass it on. And with that, thank you so much for everyone who's joined us, watching us today. And Phil, thanks for what you're doing, and we'll check back in with you soon.
All right, my pleasure. Have a good one.
Thanks, you too.